Last week I posted a video on how the functional medicine testing, especially regarding like GI testing, is not necessary, and you can get a lot of that information out of your basic blood work. And here's why I don't do the testing again. Besides the fact that I understand your blood work and I can get that data from your blood work, and a lot of times, especially at an annual, we can get blood work covered pretty easily. The average blood work that I run for people on a daily basis is around $180 to $250, depending on what state you live in. The GI map, the GI-FX, any of those tests usually start at $350. They start at $350. But here's the other thing. Most people run the GI-FX, the GI-FX by Genova, or they run the GI map. And when we're talking about specificity and sensitivity, which means basically how real is the data that the test is giving you, the GI map is reported to only have an 80% specificity and a 27% sensitivity. The GI-FX won't even allow their specificity and sensitivity to be reported. The CSAP times 2, which would be the test that I would recommend, and the test's reasoning for recommending that is because it has a 95% specificity and a 91% sensitivity, meaning it actually gives you real data. It's also, that reasoning is why a lot of insurance companies will pay for it if you get the right person to order the test. So let's say you're someone who's struggling with constipation, meaning you're only having 1 to 2 bowel movements a week, or you're struggling with diarrhea. You could ask for a referral to a gastroenterologist, and you could then ask the gastroenterologist to order the CSAP times 2, and it would likely get covered by your insurance company. Your GI doc doesn't need to know how to read that test or understand it. They just need to be willing to work with you to order it. And you can tell them, I have somebody that can read the test if you don't know how to read it. I understand that you're not trained on every single test out there. This is just one that my insurance will likely cover, and I would like to get it done because it gives a lot of information. Let's say they're still like, yeah, I don't know what to do with that data. It doesn't make sense to me to order it. It's useless information. You can back up and say, did you know that the CSAP times 2 is the basis for the Cologuard test? And we know that the Cologuard test also has a 95% specificity and 91% sensitivity in detecting colon cancer. So if you've ever ordered a Cologuard test for somebody, ordering this test is not that far out of the realm. And this is part of the educational content that I give people to help them fight for their rights as a person subscribed to their insurance, and unfortunately to the medical system we were all put in that is no longer serving us to its highest capability. The Nutra-Eval also has about a 98% specificity and a 92% sensitivity for nutrient imbalances and deficiencies. So it's looking at fatty acids, it's looking at minerals and vitamins, it's looking at nutritional deficiencies in how you are using your fatty acids specifically, and whether or not you're producing something called butyrate, which helps the body break down carbohydrates and reduces the risk for insulin resistance. If I order that test for you, it's going to cost you around $180 to $200, again, depending on what state you're in. If you can get your PCP or your GI to order it, your insurance will likely cover it because the specificity and sensitivity are so high. And in fact, both of these tests, the CSAP times 2 and the Nutri-Eval, are on the Medicare prescribed lists of tests that can be ordered. So if you have Medicare Part A and B, these are both tests that you could get covered by insurance without needing to pay a functional medicine practitioner to run the test for you and have them upcharge the test. So between your annual exam blood work, the basic blood work, and that list is on my website, and also these 2 tests, we could learn pretty much everything we need to know about you in order to help you restore your health to your most optimal vitality with very little money out of pocket. There is absolutely no Sorry, we had a phone call coming through. Absolutely no reason that you should need to spend anywhere between $1,000 and $2,000 just on testing to then join a $5,000 3-month program to work with a functional medicine provider. Most of what you need can be done with your primary care physician. In many cases, and I know this to be true because I've done it, if your primary care, or ladies, your OB-GYN, guys, your urologist is willing, you can also get them to run MTHFR specifically, and you can find out if you have a mutation there. But again, we can look in the red blood cell count and see if you're having trouble methylating, and if they run a homocysteine, which is more indicative than anything else, including your LDL cholesterol, of whether or not you will have a cardiac event or a cerebral vascular accident within the next 5 years. We can also tell whether or not you're methylating and whether or not that pathway needs supported. If you're interested in learning more about how to go about this and or how to work with somebody who's interested in helping you get all of this testing done through your primary care provider, there's a link.